Good afternoon. My name is Kgosi Letlape. I'm a forcefully retired ophthalmologist. I'm president of the Africa Harm Reduction Alliance. I oppose this bill for 3 reasons. The first reason is that the bill does not differentiate between combustible cigarettes and alternative nicotine products. And as a medical professional, being part of the profession that has recommended nicotine replacement therapy to patients for the last 20, 30 years, when a bill now declares nicotine a poison and a toxicant, it puts our ethics as a profession in jeopardy. That we've been lying and continue to lie to our patients on the differentiation between combustion and non-combustion. Secondly, the bill does not see people who smoke. It does not see them as human beings. It does not see them as people that need attention. There's nowhere in the bill where it addresses 12 million adults who smoke in South Africa as to where they can smoke. What comes out is something of biblical proportions that talks only about where they can't, but there's no safe space for them. The third issue is that when you speak to most smokers, most want to quit. And as we've heard from some of the people out here, those that smoke say they will continue smoking. Now, as a medical professional, we see a lot of people that are engaged in harmful behaviors. Our duty is to help them with those, not to judge them. Whether it's people that are alcoholics, whether it's people that engage in unsafe sexual practices, whether it's people that have non-communicable diseases in terms of being severely obese, we embrace them, we educate them. This bill leaves no space for educating of people that are addicted to nicotine. There's a potential that when I do harm reduction advocacy in terms of this bill, I either need to seek permission from the minister, like I needed to seek permission to become a doctor in the apartheid state, like I have no capacity to do the right thing. And if the minister so chooses, and I advocate to educate people so that they can make informed choices, I can be jailed for that. I cannot, in all conscience, support a bill that criminalizes an addiction. My father went to sleep, never woke up. He was a smoker. My dependents smoke. I don't want my home to be a crime scene. I don't want my family to be divided where we fight. What we expect from our parliament and from our ministry is to be able to assist those that are addicted to make proper choices. But what is necessary is the availability of alternatives that are less harmful to people who choose or can't quit. We cannot condone and support 30 to 40,000 deaths per annum and not raise a hand to how we can avert those deaths. They may smoke, but they are human, and they need to be treated as such. And we need a bill that would recognize that the environment of today is different from the environment of 20 years ago, when besides snus, there were no other alternatives to combustible cigarettes. What we need is a framework that differentiates between combustion and non-combustion and comes up with proper regulations to regulate both. I'm as concerned as everybody else about vaping amongst kids, rich kids, but I'm also concerned about the things that make illicit cigarettes readily available and cheaply to kids that are poverty-stricken. The people who are vulnerable have the highest rates of smoking. People with mental illness, people, sex workers, vulnerable communities, people that are in poverty. We need to embrace them as citizens. We have a constitutional framework that enjoins us to treat people who smoke as human too. And I'd like to support a bill that takes technology into account, that understands that unemployment and poverty are more lethal to society than smoking.